Eric Lee, and he's telling us about mesh sling complications, feasibility of accessing data from patients involved in mesh litigation.
Hello, everyone. My name is Eric Lee. I'm a fourth-year medical student at SUNY Downstate in Brooklyn, New York. And today, we'd like to present our research on synthetic mesh sling complications. I have no disclosures. Synthetic mid-ureter slings are the most common surgical treatments for stress urinary incontinence. However, the prevalence and severity of the sequelae that follow implantation remain controversial. Incidence of complications described in the literature, including mesh erosion, infection, and chronic pelvic pain, varies widely. As of 2017, over 100,000 patients filed lawsuits against mesh manufacturers in the US alone. Because of these cases are usually accompanied by complete medical records, we believe that they provide a rich, untapped case series for clinical research. Our goal is to determine the feasibility of utilizing this cohort of patients involved with mesh litigation to look further into the nature of complications, the symptoms, the severity, the impact on patients' lives, and the results of treatment. We believe this feasibility study is the first step towards that endeavor. And to be clear, this research has nothing whatsoever to do with adjudicating whether or not mesh itself causes complications, nor does it weigh in on the merits of legal cases. This is a retrospective observational study based on a review of the identified expert witness reports from litigation cases filed with a single law firm. An independent review panel was created, and they defined the criteria for mesh-related complications, and the expert opinions from litigation cases were assessed by two neutral non-panel reviewers. Complications were classified as definite, possible, and non-mesh related based on the criteria defined by the panel. Comprehensive records, those from the original surgery to the last follow-up at the time the expert reviews were conducted, were available in 97% of patients. Nearly 90% had at least one definite, and 98% had at least one possible mesh-related complication. 61 patients underwent a total of 143 procedures or surgeries to treat reported complications. This table categorizes patients into definite, possible, and non-mesh related complications. And the 61 patients underwent, again, a total of 143 procedures to treat these complications. You can appreciate here in the definite column, about half of the patients had mesh erosion and recurrent stress urinary incontinence. Of the possible column, it ranged from 2/3 to 3/4 of patients had dyspareunia or pelvic pain, and about 1/3 had refractory overactive bladder. In conclusion, the success of this study indeed illustrates that patients involved in mesh litigation cases often can offer a large source of clinical research. Mesh slings are the most common surgical treatment for stress urinary incontinence, and you can see, however, that they are not without their own severe complications. We believe that this cohort will shed additional light on the nature of synthetic mesh sling complications. We hope to recruit more expert witnesses and legal firms to participate in this important study. Any volunteers? Questions?
May I ask, you said that ethics wasn't required for this, but did any of the litigants consent to have you or your representative go through their records in such detail, knowing that they'd be used for research purposes?
Right, so these records are all de-identified, as I mentioned earlier.
That isn't the point. Did these people know a priori that these data would be used for this purpose?
Adrian, if you don't mind, I'll take that up. It's not.
Thank you.
He's a medical student. We got permission initially when I was at a different institution at Cornell. All the records are de-identified. The answer to your question is no. They gave permission. They gave permission to the lawyers for experts like me to review their records. Then the rationale was then my records became my work effort, and then those records were de-identified, so there was no patient information in the medical. They didn't review, the medical records. They reviewed my reports. We have an IRB pending now that I'm at Mount Sinai to de-identify. We've de-identified the medical records, and we're asking their permission if we can look at the medical records. Does that satisfy you?
Well, you've given an answer. I'm not sure it would go through our ethics board.
Okay. at least it's me and not him.
And absolutely fine. Thank you, Joey.
Thank you. Very nice, interesting study. Do you have any information about sensitization symptoms of the patient who have pain, who complain of pain?
I'm sorry, can you clarify that question? Sensitization?
Sensitization, I mean some kind of neuropathic symptoms who may cause chronic pain, independent or dependent of the mesh. So
Right.
you can find it when you have gynecologic examination or by questioning patient. So, for example, burning or sensation of cold. There is a lot of symptoms of sensitization. Do you have this information?
So we actually have one patient who experienced a chronic pain, pelvic pain, including comprehensive body pain throughout her entire system, and she was one of the patients that we defined as having a non-mesh related complication. The others had the pain develop post-surgery. And of course, we didn't really go into the quality assessment of what type of pain, that these patients reported.
In my experience, sometimes you have sensitization developed after the surgery, and it's the cause of the cause of the pain, and sensitization relapse when you put out the mesh. So it's but it may persist. It's
Right, that's definitely a good.
I did as part of my job as the expert reviewer, I did review all the medical records, and there were in this possible chronic pain, I would say half of them, it was clearly related to the surgery, and there was a large number of patients that had these neuritic syndromes, pain going down the medial aspect of their thigh. Literally, sometimes you could actually tug on the sling, and it caused pain in the distribution of the obturator nerve. So we have all that data, but we're waiting for the ethics review board to see if we can look at those medical records after we de-identify them.
More questions? So, thank you very much.
Thank you.